Hello, I am your host, Dr. Jack Braha, and welcome to the Medcast Plus show. Here on Medcast Plus, we bring local healthcare providers and physicians, experts in their field, to help educate us on a number of medical topics. Today we are pleased to have Dr. Tatiana Khrom. Dr. Khrom is a board-certified dermatologist and Mohs surgeon, and she practices here in Brooklyn, New York. Welcome to the show, Dr. Khrom. It's a pleasure to have you.
Thank you for having me.
So before we delve into the wide world of dermatology and skincare and skin health, I'd like you to help us introduce you to our viewers. Tell us about how you became a dermatologist, where you're from, and living here and practicing here in New York City.
Well, I was brought to Brooklyn straight by my family at the tender age of 12 from the former USSR. And I couldn't decide when I went to college which way to go, the liberal arts, law school way, versus the medicine way. So I did a double major in biochemistry and philosophy, and science won. Went to medical school and then loved dermatology ever since, and did that. Did all my training at SUNY Downstate and did a procedural dermatology fellowship where I learned to do lasers and skin cancer treatments.
So Dr. Khrom here is an expert in dermatology, and we want to start delving into this world of skin care. Skin is the largest organ on the body. There are many, many diseases that we can suffer from on our skin, but there are also a lot of cosmetic procedures which we'll discuss today, including injections and lasers, all to make us a little bit prettier, happier, better looking on Instagram or in the mirror. And so we'll delve into that right away. Botox, Botox, Botox. We hear about this injection of botulinum toxin, which is a chemical that paralyzes the muscles, basically. And maybe you could tell us a little bit more about what is the chemical that is in Botox? What does it do to our muscles?
Well, it basically interrupts the signal between muscle and nerve. And by breaking the signal, it actually allows us to look happy, where we are actually not frowning for a period of 3 to 6 months. And we use this to our advantage to prevent the deepening of the 11 lines, as you know, the horizontal creases across our forehead, and there is no pathological injection to the body. It's basically the part that just interrupts the signal between muscle and nerve.
So if someone comes into the office and they're concerned about some creases and they'd like to have Botox to relax these areas, is there anyone who is not a candidate for Botox? Is there someone who can't have Botox for any reason?
The only people who we don't administer this wonderful medication to are people with some muscle disorders such as myasthenia gravis or something like that, which is a very rare occurrence.
So most people are a candidate for Botox. What are some of the most common sites of the face or body that you've been injecting lately?
So the FDA-approved sites for Botox in particular are the 11s, which are the 2 creases that we make when we try to frown, the horizontal lines across our forehead, and the little crow's feet, which are lines of squinting, if you will.
So everything I'm seeing in the morning in the mirror when I wake up. Okay, so you can fix me. I can look 29 again. We talked about some of the on-label indications. These are the things that the FDA has approved the injection for. But what are some of the newer horizons for this injection for Botox? What are some of the new areas that you're seeing maybe dermatologists venture into, some of the off-label uses that we're using them for now?
Sure. So we all love a very sharp jawline and a beautiful neck. So named after the Queen Nefertiti, we frequently perform the Nefertiti lift, where we actually inject Botox into the platysma muscle, which is a thin muscle basically spanning this area of our neck. This relaxes the bands of the muscle and gives us a very nice and sharp jawline, which is basically what everyone wants to get.
Right.
Sometimes we use it for thinning of the face, giving a heart-shaped appearance for women, and that's injected basically into hypertrophied muscles of mastication or chewing.
The chewing muscles we could.
The chewing
muscles. Can you still eat after this happens?
So if you enjoy a large burger, you may find your bite to be slightly weaker, but other than that, people enjoy it a lot. And coming to us from Asia, we enjoy actually slimming the calf muscles. So if someone has a hypertrophied calf, either for genetic reasons or because they love doing a lot of squats
Okay.
or calf raises. We can slim those too.
So if they were too fit and they want to
Yes.
reduce that calf muscle
Yes,
bulge.
for lean and long, beautiful
Interesting.
legs.
Interesting.
Sometimes we do that as well.
You are fixing everything, it seems. So you mentioned the term before the show started. We were talking about Botox, I think I took it as. Explain to our viewers, what is this other fad or interest that people have in the Botox?
So a lot of men now enjoy looking after themselves, looking very groomed, the metrosexual male, whatever. There are so many different terms that exist. Basically what it is that men usually, typically genetically, have a low brow, and they enjoy having a more open eye appearance, and using the Botox in certain strategic places, we can actually elevate the brow. It's the chemical brow lift, and that's Botox for you.
And that's using the botulism, I can't even pronounce it today. I'm tongue-tied. The Botox
just
injection.
call it Botox,
Botox
although
is
there
easier.
are 4 FDA-approved
Right.
neuromodulators now
There are
that
different
exist.
brands out there
Correct,
of this
correct.
chemical. That Botox has some cousins out there now that are
Yes.
similar.
Yes.
So you can treat the calves, the neck, the face, the Botox, which I just found out I need to buy, and lift my eyes for all our viewers. You'll see more of my face soon, possibly, which I know is probably not a good thing. But it seems as though this is very popular. Are you seeing more men, more women? Is it equalizing?
So still the predominant patient in my office is a female, but either due to social media or due to a lot of millennials wanting to do preventative things, take care of themselves earlier, preserve their looks, there's definitely an increase in the male patient as well, and they feel more comfortable coming into the office. But definitely the social media has increased people's awareness and made it okay for people to come in seeking these procedures.
I think we see our faces a lot more than we used to because of
Absolutely,
selfies, right?
and with all the filters,
Facebook
and everyone
and
is
Insta,
everyone
yeah.
is chasing this perfect filtered look.
We're all seeking perfection, which is a good thing. I think that keeps people maybe eating better, exercising
As
more.
long we as physicians keep our patients in check and educate them about, what's beneficial for them versus what's perfect. We don't want to develop this body dysmorphic disorder of the
Right, right.
perfect selfie face. So just as long as we are honest with ourselves and our patients, I think we're okay.
Yeah, it's a challenge.
Yeah.
As we always were taught at some, in medical school and surgery, and I remember being on plastic surgery rotation, that the enemy of the good is the great, trying to get that
Absolutely.
too much of perfect. But it seems like you're able to use a very simple injection to make people feel better, look better, and with minimal side effects, correct? There
Correct.
are very rare side effects to this.
Absolutely. In our practice, first of all, you have to seek an expert in the field, someone who knows the anatomy, makes the injection safe. And also, if someone wants to give you a very natural look versus what's popularized sometimes in the media, as long as we take an 8 and make them a 10, and not just blow something up on their face that they're asking for, I think we're in good shape.
Yeah, and you brought up a very important piece right there for the viewers to know. Seek out a board-certified, someone who's trained in this, who went to medical school, who can really help you and judge, what you need and what's safe, as opposed to just looking to get payment for something. And that's an important point. We talked a bit about this cosmetic treatment that you have, Botox, to make us look better, and then you mentioned prevention. So I'm going to transition a little bit because it is still summertime, and I know I was out in the sun today a little bit, which is enjoyable and fun, and we all get that nice little glowing tan that's natural. But that could be damaging to our skin, right?
Absolutely. I actually ran out of my office today because I finished a big procedure. I'm also a Mohs surgeon, which means
that's a tedious, long
take care
procedure,
of skin cancer.
right?
So I had a patient today who's elderly, but she had a very large basal cell carcinoma that we removed in 3 stages and basically took half of her cheek off. And that was the result of all the sun damage she accrued as she was young, growing up in Brighton Beach. And definitely I educate my patients, every one of them, on the importance of sunscreen. And now we have wonderful antioxidants and things that we can do and put on our faces that actually will repair the sun damage or prevent it.
So aside from just using sunscreen, because I think we've all been, hit over the head 1,000 times to wear our sunscreen, and if we choose not to, that's just a huge mistake. But assuming that, someone wore, the proper sunscreen in the sun, what are some of the healing treatments or things they can do that are reparative to the skin after a weekend in the sun?
So right now, as we're entering the fall, is the time to start doing these reparative procedures, and this could be a combination of in-office procedures in addition to your home regimen, where we do some chemical peels to lift up all the brown spots, which is basically the sign of sun damage accrued, turn the skin over, do some laser procedures, which again will help turn the skin over, build some new collagen, and repair the sun damage accrued, in addition to doing some cosmetic treatments such as photofacials that would treat the broken blood vessels, the brown spots. So these are all things to start doing now to be ready for Christmas, New Year's, Hanukkah.
The next vacation.
And then it will help you remember.
So there is more to it than just a sunscreen. That those sunspots can still occur, and some of these damages that we can get in our face, you can help, sort of the repair in the office.
Absolutely.
You mentioned Mohs surgery, and I know back, I haven't seen Mohs surgery in years, but I remember it being a long procedure where you take little pieces and go deeper and deeper till you're free of cancer.
Right.
Describe for the viewers, because skin cancer is the most common cancer.
It is.
Skin cancer will affect, I think the statistic is 1 in 5 Americans. It's a very common cancer. So for our viewers out there, if you've heard about lung cancer and you've heard about colon cancer, the skin is still the most common. What is this procedure called, the Mohs procedure?
So basically it was developed by Dr. Frederick Mohs, and we use it for areas of the body which don't give us the luxury of take a big chunk out. So we try to preserve the most healthy skin that we can, and we reserve this procedure where basically skin cancer is removed a piece at a time in an area that is sensitive, such as the face, the fingers, the genital area, believe it or not.
To remove only as much as you really need to.
Removing slivers of skin that are checked in the office. Everything is done under local anesthesia. And removing, like I said, these slivers of skin, preparing frozen sections, putting them on microscope slides, and then us surgeons checking them, making sure that all the pathological cells have been removed and the healthy tissue has been preserved. And then we do the stitching to make sure that the area is preserved beautifully, and the patient is free to go that same day.
So patients can do this in the office under local?
They don't have to be put under, and they have the security of mind that their cancer has been removed.
With minimal damage, as little as possible.
As little as possible.
There's always going to be something, right, to remove, but not a big chunk like you said.
The skin cancers that we remove, they vary in size. So usually, we're dealing with pretty small lesions, but occasionally something neglected, like I had today in my office, will take multiple stages to remove and will take a large amount of skin off. So like I said today, my patient lost nearly half of her cheek.
And this can be prevented also from getting this far if they see a dermatologist for checkups, correct?
Absolutely. So I always tell my patients that if they have a pimple that's not healing over a month, to come in and have it checked. I've had patients with melanoma as young as in their 20s. And obviously, this is the least common skin cancer, but the most worrisome. But any of the skin cancers that we see should be treated because they're curative, and prevention goes a long way.
So if someone's looking in the mirror and they notice an abnormality that's been going on for more than 30 days, a month, like you said, that's a time to see somebody.
They should at least show it to a dermatologist who is board certified, at least have a peace of mind that everything is fine, and be able to sleep at night.
Something larger.
Absolutely.
Yeah. So, the sunscreen and these peels and these lasers that we have, tell us a little bit about how the laser works. To many of us, it sounds like outer space and, some big machine is going to come right at their head and start firing lasers. Tell us about how these work and what are some of the applications you're using them for.
Lasers come in all different shapes and forms, and they treat a plethora of conditions. Red spots, brown spots, crepey skin, large pores can all be fixed. In the past, people knew lasers as probably the CO2 laser, which took off your whole skin, you healed for 2 to 3 weeks, and it was a major to-do. Now lasers are a lot more sophisticated, and they're able to give maximal results with minimal healing. They've fractionated the lasers, in other words, instead of taking off a huge layer of skin, we're basically hitting the skin in very tiny fractionated columns. This allows us to effectively treat any condition with very minimal healing.
So people can heal up rather quickly from this. It's done in the office as well?
Everything is done in the office, and we try to customize the treatment exactly to the amount of healing time the patient gives me.
So in terms of, continuing to trying to look good, patients may be looking in the mirror saying, oh, I've got many, many pimples. Do I have acne, or is this just an isolated pimple out there? If this is going on for a while, what's the point in time where they should be saying, I need to see somebody for some expert care when it comes to breakouts or acne? What is it that you can do in the office, and when should they see someone like you?
So definitely, if any of your zits are leaving spots on your face, scars, red marks, or dark marks, you should come in and treat that, because I just read an article in one of our publications that they show how much prevention can go a long way in terms of prevention of scarring from acne, which is the big thing, right? We want to all prevent scars.
Right. People develop these breakouts, and then even though they think the redness has gone away, there's a spot that's left behind.
Correct.
So you can help prevent this?
Us educating the patient on how to take care of their skin. We review their home regimen. We do a skincare analysis, and we educate them on what products are okay to use, what products are not okay to use. People apply butter on their skin. People apply olive oil on their skin. It clogs their pores. So a little education goes a long way. We do some prescription skincare, and then we can explain to them how just little remedies in the office can make their skin beautiful and glowy.
Yeah, it's a common thing that I used to see in primary care of people coming in, popping their pimples and putting all these potions and lotions and all these things on their skin, and yet they were getting worse and worse and worse. And it's important not to ignore these breakouts, to make an appointment with a dermatologist like you who can clearly help treat this more effectively and prevent scarring and long-term damage. There was a term you brought up before the show that we talked about called tech neck. And so I want to move away from skin cancer and acne into a new, maybe it's a millennial term. It's a more modern term that I haven't heard till today called tech neck. I don't know if I have it, maybe I have it, maybe I don't, but what is tech neck?
So research has shown that the average person nowadays looks at their phone, whether it's to check their phone or to check social media, roughly 46 times a day. Millennials look at their phone twice as much. So imagine this constant motion of looking down brings about some horizontal line and ages your neck earlier than was in the past, clearly before these common practices were instituted. And so we are seeing the neck aging much earlier. So there are things that we recommend to our patients.
Throw the phone in the garbage.
Well, at least hold it like this. Don't look down like this.
Yeah.
Right.
It's only 46 times a day I'm looking. I think it's got to be a few thousand, but I must have tech neck.
When I look at my kids, it seems like it is in the thousands, I have to say. Yeah. So correcting those practices earlier and then doing some in-office procedures. We recommend Ultherapy, which is microfocused ultrasound, to make some new collagen earlier. Can correct those creases that develop from us checking our social media constantly. And then, again, doing a little Botox in the area, doing some fillers will help prevent this tech neck. By the way, I have to thank Dr. Kim Nichols, who recently published an article about this tech neck business and brought my attention to it, because I was noticing the horizontal creasing happening earlier in my patients.
Wow, thank God I didn't take my boards recently. I would have to study on this new disease called tech neck. But it makes real sense to me that, yeah, you're looking up and down, up and down. I know that between my practice, the phone calls I get in the office and the hospital, I'm probably looking down a few hundred times a day at my phone.
The
And
emails, exactly.
yeah, it's checking emails, writing back to text messages. Maybe I can counteract it by holding the phone up the other half of the time and looking up at the sky, or this is going to be a permanent problem here.
I think it's going to get worse and worse, to be honest with you.
Yeah, we rely on our technology way too much. I never thought that the phone would end up being a dermatologic issue, but you're
Absolutely.
able to go ahead.
It's the new disease.
Our viewers right now are guaranteed looking at their phones, Googling tech neck, and Dr. Khrom here is someone who's able to treat those creases or lines that we're getting from checking Instagram every 5 minutes.
And I'm myself guilty as charged as well.
Right, everyone's trying to look beautiful on Instagram, and here we are checking out their pictures, making ourselves worse. My gosh, my gosh, tech neck. Everyone watching today, tech neck is the new disease of technology.
Yeah, coined by Dr. Kim Nichols, I believe.
There's an
I want to give her
right,
credit.
Right, Dr. Nichols has obviously done some research in tech neck. I think I might be doing some research in tech neck. Let's talk about some skincare tips in general. There are all these face washes out there. I mean, if you walk into a Duane Reade or a CVS or any supermarket, if you want to just buy some soap for your face, you can't just walk up and buy soap for face. There are all different brands that claim all different things. What do you recommend for your patients just to wash their face when they want to go to sleep or when they wake up in the morning?
Well, I like to do a skincare analysis for my patients because I don't believe that there is such a thing as oily skin, dry skin, combination skin. It's a very simplistic approach to look at skin types.
So it's not a one-size-fits-all
I don't believe
thing,
so because not only are we genetically different, right? We grew up in different areas, received different amounts of ambient sunlight, et cetera, et cetera. So because of that, it's too simplistic to just call our skin combination or oily. After doing a skincare analysis and seeing the pore size, the pigment, the redness, I actually can recommend to my patients the best skincare approach. Once a week they can use an exfoliating cleanser, perhaps if their skin can handle it. And then we recommend a combination of an antioxidant or a pigment preventer in the morning, something to address their redness if they have some. And then, if appropriate, a retinol at night to help build a little collagen. So, I like a little sophistication to my recommendations, but in general, things that you can get in the drugstore from brands like Neutrogena, Eucerin, and Aveeno, these brands have done significant research and tested all their products, and just as a simplistic, early, getting a gentle cleanser would be fine.
Is there anything that, wow, I mean, face wash just seems so complicated to me, but is there anything you tell your patients to avoid? Are there habits that you see that patients are doing to their face to try to clean that you think are harmful?
They sometimes over-dry their faces with using an exfoliating face wash or scrub every day, which could be quite harsh. I would stay away from that for sure.
Over-drying the skin.
Over-drying the
thing.
skin or
Yeah.
applying oil on their skin,
Right.
which is very
Trying to
clogging.
find that happy medium right in between is tough, but
Right.
it sounds like a skincare analysis by someone who's trained in this field makes a difference. I'm always frustrated when I walk in saying, I don't know what to use to cleanse with it, so maybe I need to come pay you a visit. You'll fix my tech neck, you'll fix my brow, my Botox, and give me a face wash.
We will whip out our Vizia skincare analysis, put a UV filter on you, give your skin, basically it can give your skin an age, so you'll know how old your skin is
I just want to be 29
versus
again.
yourself.
29.
Your skin may
Yeah.
be younger than you.
You can dial it back with some of your treatments, though, it sounds like.
We can.
We really went into a lot of dermatology today, and for our viewers, it's really an honor to have someone like Dr. Khrom here. We talked a bit about skin cancer, not just sunscreen, but following up with a dermatologist to maybe help with those sunspots and the damage that's going on after Labor Day. So before Christmas, we want you to look good, under the tree or under the mistletoe, and then getting ready for vacation. It's important to see a dermatologist, someone trained in treating the skin. We talked a bit about Botox, injecting certain areas to make us look younger, to rejuvenate, or even to prevent
Prevention is
And we learned Technic, which is, I think the theme of this show is Technic. I'm so impressed by this problem, I think I'm going to go throw my phone out, and I'm sure the hospital
or
will.
at least hold it like
I'm going to
that.
hold, yeah, we're going to walk around like this, and I'll be the only guy walking around like that. I'll step into a pothole or something. And we also talked about lasers and these really neat devices that you have that maybe years ago took a lot of time to heal from, but are really advancing in technology. And patients can be treated in the office for all sorts of spots and veins that look abnormal or blood vessels that look abnormal.
Absolutely.
We only have about a minute or two left. What's one of your messages to patients out there watching today who really just want a good dermatologic analysis, dermatologic tips of where should they go for care, what should they look for in someone's credentials when they're searching out a good skincare specialist?
So the take-home messages for my patients are avoid tanning beds,
Big one.
use sunscreen on this upcoming Labor Day weekend, and then look up the credentials of your patient. Make sure you're seeing a board-certified dermatologist or a physician assistant who is working with a board-certified dermatologist, and make sure you do a full body check once a year.
For skin cancer.
For skin cancer, yeah. And if any of your moles are changing, come in.
Yeah, I think that's really important. That Dr. Khrom really summarizes it, for us, is that see somebody.
Absolutely.
See a specialist. There's a lot of people out there gallivanting saying that they're doing laser and they're doing injections, but they're not like Dr. Khrom,
And to
who's
be
an
honest
expert.
with you, I have no problems telling my patients, I don't know what this is. And if I don't know what something is, I'll do a biopsy.
Right.
You need to have someone honest like that.
So once a year, get a skin checkup, just like we go to the doctor for blood pressure, for cervical screening, for breast screening, colon cancer, all these things. You're a key role here because skin cancer is the most common cancer. About 20% of people will develop one of these types of skin cancers.
Absolutely, especially if you're single and no one sees your back. Come in.
That's a good point. Okay, that's a key take-home right there. If you can't see your back, which we can't see 50% of our skin, that's correct.
Right.
See a specialist. Dr. Khrom, really, thank you for coming on. I learned a
Thank you
lot,
for
and I'm sure our
having me.
viewers did. Thank you. We really appreciate you coming on. I want to thank you for watching this episode of Medcast Plus. I invite our viewers to follow us on social media, get in touch with us on Instagram. And my name is Dr. Jack Braha. You can find me on Instagram at GIJack. Visit us at medcastplus.com. Check out our tools. And you can also call us at 718-510-2103 for more information. Again, I'm Dr. Braha. From all of us here at Medcast Plus, stay healthy.